Everybody, welcome again to the Ministry of Health. Somewhat smaller cadre today, so well done to those of you who have come out on a Sunday, and thank you for supporting our efforts and also for including the sign language interpreter in your picture. So I can start by saying that we just still have the one confirmed case of COVID-19 in New Zealand, and that person is still in hospital and stable and continuing to improve, which I'm sure people will be pleased about. I'm going to just provide an update on the contact tracing in response to that case, our actions being taken at the border, and also a little plug for our public awareness campaign as well. So as I said yesterday and the day before, the positive test is something we had prepared for and were ready for. And whilst we've had that one positive test, and so are among the countries globally, an increasing number of countries that have a case of COVID-19, we still believe the likelihood at this point of a community outbreak is low. And you can see, just looking across the Tasman at Australia, that's had cases, sporadic cases like this for now 4 weeks. Their number of cases remains relatively low, and they have been able, through good public health measures, to prevent onward community spread. The job of tracing the person's other close contacts is progressing. We've revised down from 20 to 18 the number of passengers who sat in one of the seats of interest for more than 15 minutes as we get more information from people about the flight. So the purpose of the contact tracing, of course, is to identify those people who are potentially in close contact with the original case, and therefore may be at higher risk of having been infected. And so we trace those people, we pop them in supervised self-isolation, which means they have regular daily contact with the public health unit, as well as an initial health assessment from the public health unit, and this is designed to stop any possible further spread. This is essentially the same rationale for why, when we brought back the Kiwis and others out of Wuhan and the Kiwis off the Diamond Princess, we have put them into, or in the case of the Diamond Princess folk, they are still in quarantine. That is to limit further spread. So there's been initial contact with all 18 of those people. You will recall that on the passenger arrival card, when you come into New Zealand, you're required to provide an address and an email or a cell phone number. So in some cases, it's an email to these people, in some cases it's a cell phone. Where it's email contact, we're then following up all sorts of other channels to make sure we're making personal contact with those people and therefore getting them into that supervised self-isolation. The remaining passengers on the flight, that is those not in close contact with the original case, are being contacted either by Healthline, if there's a phone number, or through email by Auckland Regional Public Health Service. And the information for them is the same as anyone coming into New Zealand from a country that has COVID-19. If you become unwell, then please contact Healthline, or if you are going to visit your GP, please do call ahead first. Now, we do know that spread of any infections in an aircraft is limited by the air circulation systems, because they have excellent filtration systems in modern aircraft, so that this disease, which is spread by droplets rather than aerosolized, is only likely to spread to those in close contact. A little plug for our public awareness campaign and the key messages in that, and the steps Kiwis can take to help look after themselves and protect their families and others from the disease. It fits very much with the WHO's advice around washing hands regularly with soap and water. The prescription there is to sing happy birthday twice, probably not allowed, but sing happy birthday twice while you wash your hands, and that's the 20 seconds apparently, or use an alcohol hand rub, very effective. Clean surfaces regularly with disinfectants, as well as kitchens and workbenches, and avoid travelling or indeed going to work or to being in contact with others if you have a fever or a cough. So it is important that everybody plays their role in doing the right thing to take precautions for themselves, their families and their communities. And I think really important again to acknowledge the efforts of many people over these last weeks, many Kiwis who have voluntarily accepted going into self-isolation to reduce the risk of bringing an infection from China and more recently Iran into this country. And of course, the family of the case we have who did all the right things off the back of hearing an announcement in the airport about the importance of calling Healthline if you became sick. And I just want to repeat again the line from the Director General of Health, the Director General of the World Health Organization, Dr. Tedros, that facts, reason and solidarity are our greatest asset. At the border, we talked yesterday about what we're doing to essentially increase the availability of information, essentially so it becomes a universal approach. Every person coming into the country will get information about COVID-19 and what to do if they become unwell. So we are moving to have all airlines making in-flight announcements and providing the health card with the arrival card while the flight is on its way to New Zealand. This will ensure everybody has that information. It will be available in a range of languages. And then the measures at the airport will remain to ensure that we can continue to enforce the border restrictions for people who have been in either China or Iran. And of course, our health presence at the border, which includes a nurse to assess anyone who may have any symptoms as they arrive in the country. I've had some feedback from Healthline that there's a little bit of confusion about this move to Category 1 and Category 2 countries. So the purpose of the categories is so that anyone who has been in these places, either their countries and jurisdictions, who presents with symptoms, that their presence or the fact they've travelled to one of these places is considered then into whether a testing for COVID-19 is done by clinicians. So the Category 1 countries, though, are currently China and Iran, and the requirement there is, in addition to the travel restrictions for non-New Zealanders from those countries, the requirement is that people travelling into New Zealand from China and Iran are required to self-isolate for 14 days. The Category 2 countries are not, or jurisdictions are not required to self-isolate for 14 days, but if they become unwell, they should call Healthline or call ahead to their GP and let them know that they have travelled to those places. And just a reminder that those countries or jurisdictions are Hong Kong, Italy, Japan, the Republic of Korea, Singapore, and Thailand. That information is on our website. We've now undertaken 136 tests since we started testing in New Zealand in late January. Obviously, the one positive result, the others negative, and 11 of which are still under investigation. There can be a slight lag in reporting over the weekend, and we'll have a fuller update on that tomorrow. Finally, just a reminder that anyone who does develop symptoms, and if they have travelled to one of those countries or jurisdictions with places of concern, then please call Healthline, or if you're intending to visit your GP and you're concerned that you may have COVID-19, please do ring ahead so they can put the appropriate precautions in place. So thank you very much, and I'm open to questions.
Could we get a little bit of clarification, Dr. Bluefield, around there's 3 others, I think the ministry said, who came and sat on some of the empty seats. And there was a bit of confusion on just the total amount of people who are at risk. It went from 20 to 18. But were those 3 factored into that, or?
Yes. So the original 20 included people who said they had spent some time in those seats. After further inquiry and discussion, we've narrowed it down now to, or the Auckland Regional Public Health Service has narrowed it down to the 18, because people who came and sat in those seats were not there for the 15 minutes. So at much lower or no risk really of being a close contact, not considered a close contact.
So of those 18, has anyone tested positive, or is it too early to say?
Yeah, so none of those people will be tested unless they become symptomatic. So the key thing here is to ensure they are in supervised self-isolation. And again, if we reflect on all the people who came back from Wuhan, out of the epicenter of the outbreak in China, and who were all in supervised quarantine, none of those people tested positive. So again, it's low risk. The person who has been identified as with an infection was wearing a mask throughout the flight, so that will have reduced the likelihood of droplet spread. and this is just a precaution, and so those people can be observed for the 14 days to ensure that they are not infected.
So they're in self-isolation at the moment?
They will be or are in supervised self-isolation, yes.
With the 11 who still haven't returned the test, how is the ministry locating these people? Is this people who have phoned Healthline or something who are have now been followed up with the formal test, or how did the ministry come in contact with those 11?
So the 11 are part of the people from around the country who may have travelled to one of the places of concern, presented with symptoms that may be suggestive of COVID-19, for example, a cough or a fever or difficulty breathing. None of the people fit the definition of a suspected case, but we've had, as you can see, with over 130 negative tests, quite a low bar for testing, essentially to rule it out. And so the 11 that are currently under investigation would be in that category, and they are from around the country. So people who've either called Healthline and been advised to go and visit their GP, or perhaps have presented at hospital with symptoms and it's been ruled out as what we'd call it as part of the differential diagnosis.
Do you have an update on the New Zealand passengers who were on the Yokohama cruise ship that were hospitalised in Japan?
Oh, so there were
On the Diamond Princess.
on the Diamond Princess. So there was an initial 2 and a family member stayed with them. They're back in New Zealand. And then there was another 2, and I'm sorry, I don't have an update on those, but we can find that out for tomorrow's stand-up.
They're still in Japan.
I'm not sure about that, so yes. I haven't heard that they're out of hospital as yet, but we will get an update on them for tomorrow.
Would we be able to get an update also on regarding the one who does have coronavirus, this person's family members? There was at least 3, I think, who the ministry was had asked to self-isolate, I think, or how are they doing?
Yes, so the family members of the case are in isolation, self-isolation, which is great, and doing everything. They know what their responsibility is and doing everything that is being asked of them. And they are, of course, being monitored as well to ensure that they remain in good health.
Does the ministry think that this person has had come into contact with anybody else, or does it still maintain it was just the people on board the flight, possibly, and the family members? Or
yes, that's correct. It was a very short time. The person was picked up by family members, travelled in a private car, and it was a very short time after that they called Healthline, and then the person went into the hospital to be investigated. So that's good. It's well contained.
You're refusing to say whether or not the person is male or female, is that right?
Well, I'm not refusing to say. I'm just as a matter of privacy. We're saying the person, yes.
Can you not identify the sex? I mean, it's hard to see how that's going to identify them.
Yeah, so I'll just prefer to stick with what we've been doing so far. We've said it's a person in their 60s, and the important thing is they are recovering well.
And just so those 18, are they at home in self-isolation, or are some of them in hospital?
None of them are in hospital.
They're all
Yeah.
at home.
Well, some of them are not New Zealanders, so they're not necessarily at home. But I don't have further detail on that. Some are visitors to the country.
are they spread across the country, or are they all in
Yes.
Auckland? Or?
They are. Some are in Auckland, some are in Nelson, and there's at least one in Christchurch. So as you know, Auckland's a portal really for the rest of the country for international flights.
How are public health officials dealing with that kind of? Are there less resources in, for example, Nelson, or does the ministry have people who can cope with this all over?
Yes, so we have 14 public health units around the country, and they have staff in all the major centres. And even if we think about, say, Southern District Health Board, based in Dunedin, but they have staff permanently in Queenstown, and in fact some of those staff are currently meeting all the international flights that come into Queenstown as part of ensuring anyone coming into the country gets information about what to do if they get symptoms.
If we did get more cases, what do you think of the idea of establishing safe havens, so areas where vulnerable people could stay safe?
Yeah, I think it's a very novel idea, not actively under consideration at the moment. We're really guided by our pandemic plan, and I've spoken with Professor Michael Baker about this idea. He's floated it and said it was something that was done in 1918, or it's now 2020. So I think the world's a much different place, and so we'll be guided particularly by our pandemic planning. I think the point he's trying to make is, while we still are effectively in the keep it out phase, now is the time for us, if we have as much time as possible, we can plan and look at a whole range of options as we see what happens as the disease evolves.
What about Samoa not taking flights from here? Is that a bit of an overreaction?
Oh, I think that's very much a decision, as you would expect, for the Samoan government, and I'm sure they are extremely mindful of the experience they had last year with measles and the impact that an infectious disease can have on a population where there is no or low immunity, and that's what they're responding to, and I think that's absolutely their decision.
Can we just quickly get an update, Dr. Bloomfield, on the people at Whangaparoa? It's been a while since we've heard kind of anything on them. Are they still there, and how far through are they of their 14 days? Will they be released soon?
Yes, I think their 14 days comes to an end this week, and they're all well. They're being checked daily, so I'm sure they're looking forward to the end of it, and as you say, their release back into their usual lives. So we'll give an update on that tomorrow, just to let you know what the timing is for their finishing up there. Thank you very much, everybody. Appreciate it.